usual, this briefing is being live streamed online, and we will take up questions from the online viewers of the registered international media. We have also already made available all the materials to be used during this briefing. So if any of you following this session remotely has not yet received those materials, please contact us by email at International Press Division Japan. First of all, let me introduce today's main briefers. On my right, we have Mr. UMEDA Hiroshi, Director of Infectious Disease Information Surveillance Office, Tuberculosis and Infectious Disease Control Division, Health Service Bureau of Ministry of Health, Labor and Welfare. On his right, Mr. WATANABE Shoji, Director General, Office for Novel Coronavirus Disease Control of Cabinet Secretariat. And on his right, we have Mr. KITAURA Yasuhiro, Director of Foreign National Affairs Division, Consular Affairs Bureau of Ministry of Foreign Affairs. And on his right, we have Mr. MATANO Seiji, Attorney, Deputy Director of Immigration Department of Immigration Services Agency. Without further ado, let's move on to the opening remarks of today's speakers.
皆さんこんにちは、厚生労働省の梅田でございます。まず私の方からですね、直近の感染状況について、ご紹介させていただきたいと思っております。接客を伴う飲食店などハイリスクの場における積極的な対応でありますとか、都道府県による自粛要請への協力、市民の行動変容の影響などもあってですね、新規の感染者数は8月第1週をピークとして全国的に減少に転じてきております。ただ直近になりまして、その傾向に鈍化が見られるということでもございます。8月最終週以降ですね、複数の自治体において、新規感染者数の減少が止まってしまうという動きでありますとか、一部増加に転じるような動きもあると。こういった動きがですね、全国的な感染拡大につながることのないよう、警戒を続けていく必要があるというふうに考えているところでございます。簡単でございますけれども、直近の足元における感染状況についてご紹介させていただきました。
はい、感染状況につきましては、ただいま厚生労働省さんの方からご説明が届いています。私内部幹部の方でございます。私の方からですね、イベント制限とかですね、キャンペーン等につきまして、まず経済の状況なんですけれども、
There was the emergency declaration. Compared to that situation, of course, the impact of the infection does continue on the economy, but still, economic recovery trend is continuing according to observation. Going forward, we'll continue thorough prevention of the spread of infection and enable the compatibility with the economic and social activities. That is, by establishing the so-called new normal, it is important for us to bring back the economy to a growth track. Under this backdrop, regarding the restriction holding big events, in the handout, please find this PowerPoint, a single sheet PowerPoint. Traditionally, the participants was capped at 5,000 individuals and either capped at the lower of 5,000 participants or at 50% of the venue capacity. It was either of. But for the time being, until the end of November, the cap is going to be relaxed. But the assumption is that there is thorough measures to prevent the infection. The cap of participants will be eliminated, but the cap will be 50% of the venue capacity. If the venue capacity is up to 5,000, events that do not expect to have large cheerings or shouting events that do not expect large voices like classical music, concerts, or performing arts, the participants up to 100% of the capacity will now be permitted for the time being. As for the Go To campaigns, again, repeatedly, on the assumption that there's a thorough prevention of infection. First, about the travel, Go To Travel. From October the 1st, which is tomorrow, Tokyo departure and arrival within Tokyo metropolitan area, the travels of Tokyo will be added. Number 2, about the Go To Eat, about eating and dining, eating and drinking outside. The online reservation of such facilities that will be available from tomorrow, October the 1st, and the dining coupons will be available from the early timing of October. And the third point about the Go To events and Go To shopping malls, this is planned to start from around the middle of October. When infection spread during April and May, emergency declaration was issued, and by extensive voluntary restrictions of economic and social activities, we tried to contain the expansion of the infection. During July and August, again infection spread. There was targeted effort onto the important areas, which is entertainment commercial zones. There was targeted PCR tests in high-risk areas. By requesting closure of businesses or shorter business hours, we implemented focused and targeted countermeasures, and as a result, the nationwide number of infections are on a declining trend, according to observation. So based on these two times of experiences, data is analyzed carefully, infection control measures are conducted in a targeted and effective manner, and by evolving these measures is necessary. We have to expect further waves of infections, and therefore thorough analysis of data is required in order to consider the next steps of countermeasures. By doing so, prevent the infection, but enabling economic social activities is to be implemented. My final point. In order to enable both infection control and continuance of economic activities, we observe that digital transformation, DX, is necessary. And therefore, new technologies and innovations, including digital transformation, will be extremely important. Relevant ministries and agencies and corporations are required. Business, academia, government, corporation are required, so that in a new world of corona, new technology that can be utilized for countermeasures, the government must conduct public relations, because exhibitions or expositions or fairs, such events cannot be organized or difficult to organize in the recent days. But despite that backdrop, the government must cheer for and root for new technologies, public relations, and by using new technologies in event organizations, we try to rationalize the current restrictions on big events. And we wish to continue our efforts on such demonstration, tests, and experiments. Thank you for your attention.
それでは私の国際的な人の往来
So for my part, I'd like to introduce you recent aspect of the resumption of cross-border travel and other measures. We'd like to expand the scope of cross-border measures to be permitted to newly enter Japan. In regard to the residence track from October 1st, in addition to business travelers, we'd like to expand to cover the holders of statuses of residents of student, dependents, and others, and they will be permitted to enter Japan from October 1st. Furthermore, in principle, from October 1st, cross-border travelers of all countries and regions who fall within the above-mentioned scope will be incrementally permitted to enter Japan under the condition that the person is hosted by a company or entity that can assure observation of quarantine measures. However, the number of people to be permitted to enter Japan will be restricted. And regard to border control, which was decided at the 42nd meeting of the novel coronavirus response headquarters, and of the control measures to be maintained with regard to the arrival airport, in light of the conditions, including testing capabilities upon arrival of each airport, relaxation will be implemented once such conditions are met at each airport. That has been decided.
Okay, thank you very much for all the speakers. Now I'd like to open the floor for questions, starting from the journalists who are here with us today. And upon my pointing, please mention your name and affiliation before asking any questions. So the floor is open.
My name is Patrick Welter, Frankfurter Allgemeine Zeitung. I have some questions concerning these immigration or these entry restrictions or the relaxing of the entry restrictions. Can you please explain a little bit more in detail who is allowed to enter beginning October 1st? Then you mentioned that there will be a limit to people that might come into Japan. What will be the number of this limit in the first weeks, and how does it compare to the number of people, foreign people, that entered Japan over the last months? These are my questions. Thank you.
Thank you. MATANO of Immigration Services Agency. As of October the 1st, from tomorrow, about the resumption of cross-border movement of people, please allow me to talk again. There are basically 2 points. Number 1, from countries and regions where the infection is contained, there is the bilateral so-called residence track regime. So the people who have status of residences, this was limited only to people who had some business-related necessities. From October 1, not only business status of residence, but international students or dependents, including families. So that is except short-term tourist travelers. For all the others, other than short-term travelers, new entry into Japan shall be permitted. The second point, in addition to that, across the world, countries and regions from across the world, similarly, apart from short-term tourist travelers, non-tourists, including business people, students, dependents, including families, new entry shall be permitted. However, in this circumstance, infection control must be assured by host companies or entities. That would be the condition, that there is a host entity who would assure a quarantine. So they will have to submit a written pledge that they will ensure quarantine measures. As for the number of persons, the cap on the numbers of persons who would be permitted to come into Japan, at the airport, quarantine capacities will determine. If the quarantine capacity is exceeded, if the capacity is not enough, it will be difficult to accommodate. It depends on the testing capacities at respective airports. About the recent number of entries into Japan, the non-Japanese, the foreign nationals per day, it's just slightly below 1,000 per day or so. In addition to that, there are Japanese returnees. Again, they will be subject to quarantine testing at the airport, but even including those Japanese returnees, it is within the testing capacities at the respective airports. If I may add, this is MHLW. If I may add a bit more information about the quarantine test at the airport, the saliva antigen quantitative testing using the saliva, the subject will provide the saliva, which means that is easier, less invasive for the test recipient, and antigen quantitative testing will be introduced into airports to accelerate the testing, and by doing so, waiting time will be shorter for the arrivals. Minimum 5 hours. It could have taken 1 hour, but now it would be shorter, down to 1 to 3 hours of waiting time. So we are trying to shorten the time. As for the antigen quantitative testing equipment to be deployed and to expand the testing booth or expand the waiting spaces for the arrivals, we are working on that within the month. Within today, more than 10,000 testing capacity should be available according to our effort and expectations. Well, that is the plan as of today, which means end of September. The 3 airports, Tokyo, Narita, and Kansai International Airport. At the 3 airports, we have started our efforts initially. So in those 3 airports, additional testing capacities will be prepared. In other airports, systems shall be deployed in the mid and longer term. In other airports and expanding inbound tourists, we will expand the accommodating capability.
Patrick Welter once again. Concerning these numbers, so you say that the capacity right now for testing at the airports is about 10,000 a day, and what will be the number at the end of the year according to your plans? And the second question, when you mentioned that the entry will be limited due to the capacity, how do you plan to manage the system? If you have 10,000, if there will be 12,000 suddenly coming a day, are you going to send these people back? Are you going not to let these people start from their home country or from their travel? How is this going to work?
Thank you for the question about the testing capacities and the prospect going forward. As was mentioned earlier, at the moment, 10,000, slightly above 10,000 persons can be tested. Going forward, of course, depending on the demand, we will implement our efforts. But would it be 100,000 per day all of a sudden? That kind of sudden expansion is not realistic, but there will be an incremental increase and there will be thorough testing in order to ensure appropriate border control. So depending on the needs, demand, and ensuring effective testing capability, our effort will continue. But by the end of this year, up to how many persons? It depends on the demands. Therefore, at this moment, specific concrete number is not available.
Any more questions from the floor?
Can you explain the second question? How does it work when there are 12,000 people who would like to come in per day? Sorry, there was a second question. How do you plan to manage the number of people that would like to come in, and you have the restriction of 10,000 per day? If there are 12,000 who would like to come in per day, how do you manage that?
Thank you for your question. By the end of the year, in principle, the testing capacity is 10,000 per day. The Immigration Services Agency earlier discussed that at the moment, the foreign nationals entry is almost 1,000, slightly below 1,000 per day. So if it happens that the foreign arrivals become larger, which has not happened at this moment, that's still a hypothetical question. And therefore, at this moment, I would like to refrain from responding at this moment because it is still hypothetical. However, if in the future, if foreign arrivals exceed our testing capacity, some kind of measure shall be considered. Thank you.
Thank you. Rocky Swit with Reuters. Question. The United States has suggested that they may consider emergency authorization for COVID-19 vaccines. Can you comment on Japan's position on this? On the first vaccines are expected to be available as soon as the end of this year, early next year. What would be the approval process, and could it be accelerated in Japan in the same way? Thank you.
This is MHLW from the International Affairs Division. About the vaccine approval of other jurisdictions, MHLW is not in the position to comment about other jurisdictions, but at the Japanese Ministry, MHLW, there are vaccines under development. Regarding such candidates, preparation is made towards potential contracts, but regarding the approval screening, it's up to the latest scientific information, including data, efficacy and safety have to be thoroughly ensured. Thank you.
That was Mr. Taguchi Kazuho, Director, Office of Global Health Cooperation, International Affairs Division of Ministry of Health, Labor and Welfare. Any more questions from the floor? Peter, please.
Sorry, I'm a little disorganized today. Peter Landers from Wall Street Journal. What is the status of returning to the country Sainyukoku for foreigners in Japan? Is that completely open now? I haven't quite understood what the current policy is. And the second question is, there was a list of countries, I think, with whom negotiations are underway over business-related entry to Japan. But there are many countries, such as the U.S. or European countries, that are not on that list. Are you planning to add them to the list at some point? Thank you.
About the first question on re-entry, those who do have their status of residence from the 1st of September of this year, for all, re-entry has been permitted. In that event, before departure, there must be negative testing certificate, and also quarantine testing on arrival is required, and beyond the arrival they must follow the request, like 14 days of quarantine, staying at home, accommodation, not to use public transportation. Those are the conditions to permit re-entry. Regarding the second part of the question, at the moment, under the residence track and the business track, Thailand, Vietnam, Cambodia, Taiwan, Malaysia, Myanmar, Laos, Singapore, Brunei, those 9 countries and regions. Between those 9, we have started the implementation of agreed to start Australia, New Zealand, South Korea, China, Hong Kong, Macau, Mongolia. Between those 7 countries and regions, negotiation is undergoing. As you have correctly mentioned, at this moment, the United States, the European countries are not listed in these countries and areas. But earlier, when I mentioned earlier, regarding all countries and regions across the world, the business track and the residence track, for persons with similar conditions, re-entry will now be permitted as of October 1, and therefore from the United States or from European countries, new entry into Japan will now become possible October 1.
以上です。
Thank you.
So any more questions from the floor? Then let me move on to some questions from online viewers. And then maybe before adjourning, I might ask for any other questions from the floor. Okay. Actually, we have several related questions from the online viewers. Let me present one by one. We have two questions from Ms. Kari Nishimura of Radio France. So let me read out those two questions. The first one is, it's been announced that the foreign national with long-term visa will be allowed to enter from Japan from October 1st, around 1,000 people a day. I would like to know how those people will be selected. Priority or other according to the status or depending on the COVID-19 situation in the country they come from? That's the first question. And the second question is, if a businessman from France or other country is allowed to enter in October, will his or her family also be allowed to enter at the same time, even with different status or at a different date?
About the first question, as was mentioned earlier by MHLW and the Immigration Services Agency, the quarantine capacity at the airport is 10,000 per day. At the moment, the entry by non-Japanese is roughly 1,000 per day, and therefore under the new regime, how much demand there will be, how many foreign nationals will wish to enter Japan, we would like to observe and think about the measures. At this moment, there is no concrete criteria. About the second question, those with business status of residents and about their dependent, including families, as long as the required procedures are implemented, entry into Japan at the same time will be possible. And of course, at different timings, as long as procedures are fulfilled, at a different timing, dependents and families can come in. Thank you.
Okay, we have one related question from Mr. Jake Sturmer of ABC News of Australia. His question is actually regarding the time frame for tourism. When do you expect tourism to resume from the countries that had the virus under control? Do you expect this will happen in time for the ski season?
Mr. Matano. So far, the whole of government has been observing the trend of infections, including Japan and other countries. The government has analyzed the situation, and depending on that, re-entry was permitted or a new entry like October 1 has been decided. As for the entry by tourists, at this moment, nothing has been decided. Going forward, we will continue to observe the infection trend both in and outside our country. The whole of government will study whether any relaxation is possible. Thank you.
And we have two questions from Ms. Motoko Rich of New York Times. Her questions were as follows. Regarding the digital transformation efforts, how much emphasis will there be on working from home on a regular basis? You talked about digitalization in terms of large fairs or conferences, but for many people, the flexibility that comes from the regularly being allowed to work from home is more significant in terms of improving working conditions. Will that be an emphasis? And the second question is as follows. What preparations are you making for winter and flu season when people will be forced to be inside and it may be more difficult for people to dine or meet up socially outside? Those are two questions from New York Times.
Allow me to respond about the first question about organizing events. Physical, real events are difficult to organize. As long as infection control is in place, physical in-person meeting, face-to-face meeting, or direct real observation of exhibition, we understand the importance, and therefore, as much as possible, we want to enable real physical events. But as you asked in the question, the cyber world or tele systems like remote participation or online web-based events, again, there are advantages, there are conveniences. So by both, we want to be more proactive in promoting both or hybrid types of events. Relevant ministries and agencies will work in solidarity in order to enable such events. Policies shall be implemented by the whole of government about teleworking, working at home. The expansion of teleworking. In the case of Japan, the morning hours, it is known for horrible congestion on public transportation. It could ease such horrible congestion. Or maybe the work efficiency will rise, working productivity might rise, and therefore regarding teleworking, more than before, the government would make requests to relevant ministries and agencies, and also the government ourselves. We will also further promote teleworking, and therefore we want to strongly emphasize teleworking. The second question about the influenza, about both infection circulating during the winter. MHLW may have further information, but just one word from myself about seasonal influenza. Eating at home or eating out of home during this time before the winter influenza season arrives, the 3 C's, closed, crowded, all must be avoided. Diligent washing of hands, cleaning, sanitation are important. And more recently, shouting, speaking at large voices, longer term shouting at close distances, using your voice, that is known to be very high risk, whether it is indoors or outdoors, in close distance, loud voice, that should be avoided by taking care of such risky conducts and behaviors. More severe restrictions hopefully can be avoided going forward. Thank you. This is MHLW. About the seasonal influenza, when the winter influenza arrives, and about the medical services capacity is what I want to talk about. As you know, in Japan, about seasonal influenza, during the winter season, there is the seasonal influenza. In particular, the peak is at the beginning from the end of the year to January or the beginning of February. That is the peak. It depends on the year, but end of December, January, February, those are the peak of winter seasonal influenza. At this moment, across the world, seasonal influenza has not started to outbreak. However, going forward, in Japan, of course, we will be happy if there is no circulation of seasonal, but we cannot be so optimistic, and therefore, as usual, we shall have to be prepared that there will be the seasonal influenza at that timing. Medical services to accommodate both the novel coronavirus and the seasonal influenza. We have been studying about that, discussing about that already. By clinical symptoms, whether it is seasonal influenza, if there are respiratory syndromes, and whether it is the novel coronavirus, it is very difficult to distinguish the two in terms of the symptoms, and therefore how to provide medical services in order to prevent the spread of novel coronavirus. Medical service is going to be crucially important. So far, medical institutions who would accommodate coronavirus potential patients, we have tried to limit the number of medical institutions who can deal with the novel virus. But the seasonal influenza, normally patients first go to family doctors. Therefore, when seasonal influenza arrives, limited medical institutions with concentrated patients cannot accommodate. Therefore, first of all, in terms of medical service capacity, patients with fever, febrile patients, they went to returnees and contact the consultation centers prior to visiting doctors. But in the local regions, in close to home, family doctors, first visiting family doctors, that medical service system should be prepared within October. In that event, at the family doctor, if test is conducted and to identify, distinguish novel corona or seasonal influenza, in order to enable distinction, testing, antigen testing kits must be available at the family doctors. About 200,000 tests per day or so. Such kits capacity is under preparation at this moment.
Thank you very much. And we have 3 questions from Mari Yamaguchi of AP. これ日本語です。
It's in Japanese. In Japan, the so-called second surge, in this present surge, the number of deaths and the number of infected, tested positive, it's been limited. But what do you think was effective in keeping those numbers down in Japan? So that's the first question. Would you like to take that? Then I will say all the questions. The second question. Recently, in Tokyo as well, 100 to 200 people have tested positive, and nationwide as well, the number of infections has been hovering at a lower level. Why is that? As we head toward the flu season, what type of measures will be necessary? Maybe there's some repetition with the previous question. Question 3, and in that case, in this season of the year, if we are going to take a phased approach in increasing cross-border travel, what type of other precautions will be necessary?
Specific information will be explained by my colleague from MHLW, but about the possible second wave. In the case of Japan, those tested positive or the fatalities compared to countries other than Japan, that the numbers are lower in Japan, you mentioned. So far, by analyzing various data, trying to find out the reason, it is very important because depending on the reasons, the future countermeasures can be more science-based. At this moment, according to the data, by assuming implication from the data is mask wearing, avoiding the 3 C's, those behavioral factors seems to be very important. Comparing May and July, a major difference is the PCR testing numbers. On top of that, when clusters have occurred in entertainment areas or known entertainment areas, July and August, there were extremely targeted testings, which is different from April and May. So in terms of the phenomenon, we believe those were the influential factors. This is MHLW. May I add a little bit more information? In terms of countermeasures, already if there is a case, the Public Health Office, Hokenjo, will conduct hearing interviews to those infected, and there will be positive epidemiological testing. So by positive epidemiological testing, the factors for infection and the prevention of further infection were conducted. So-called clusters were to be contained. Regarding this particular disease, that was very important to contain further spread. That was the understanding even during the first wave. During the second wave and at this latest peak, we will make thorough activities to contain the clusters in order to prevent so-called explosive infection that we observe is an important factor.
Thank you very much. And we have 3 more questions from the Mr. Simon Denier of Washington Post. Those 3 questions are related to vaccines. The first one is, given that Japan's infection numbers are still relatively low, do you have enough Japanese cases to make sure that following vaccines are safe and effective to use here? And the second question is, won't it take many months to carry out the testing of vaccines and approval process? And the third question is it realistic to vaccinate everyone by middle of next year? Those are 3 questions from Mr. Simon Denier. Taguchi-san, お願いします。
About the vaccines. This is Taguchi, International Affairs Division, MHLW. August 28, information was announced. Release as of August 28 regarding the future activities on the novel coronavirus. So by the middle of next year, there should be doses enough to vaccinate all the population. This is about the contract to supply vaccines. So far, from Pfizer, there should be 160 million doses by June, and AstraZeneca UK from the beginning of next year, 120 million doses, and out of that by March, 30 million doses. That is the basic agreement reached. The US Moderna, from Moderna Inc., between Takeda regarding the distribution inside. From the first half of next year, 40 million doses is expected to be supplied according to the ongoing negotiation. At any rate, regarding the approval of vaccines, as was mentioned earlier, as has been done traditionally in Japan, the data of clinical trials and based on the latest scientific update, efficacy, whether it is easy, useful, and whether they are really safe or not, that has to be ensured before approval. Based on this traditional approach regarding the vaccine for the new coronavirus, the approval process will have to go through. However, as for the specific time required for the screening, there is no successful development yet, and therefore I shall refrain from making any prior judgment of comments. This is MHLW, UMEDA. Additional information. In the last part of the question, to develop effective vaccines, is it really realistic or not? That's a very difficult matter, as was just explained. At the moment, in terms of safety or efficacy, sufficient assessment have not taken place according to media reports. That vaccine may be panacea, that is a silver bullet as long as vaccines become available, that we can all overcome this new novel coronavirus. That might be the impression of media reports, but vaccine alone, developing just the vaccine does not allow us to overcome the novel coronavirus. That is uncertain. And as for the vaccine itself, it may be effective, but it may come with side effects, adverse events as well. And therefore, in that regard, right at this moment, whether it is realistically going to be effective and useful, nothing can be mentioned with certainty at this moment. So I want to inform you that according to some media reports, just because reaching agreement about the supply of vaccines, there might be very high expectations, but there must be very careful assessment. Side effects, adverse events must be studied, and thorough screening is required according to our position.
Thank you. It seems that we have already taken up all the questions from the online viewers today. And also, I just been informed that we had sound problems at the beginning of this briefing. And on behalf of all the staff, I'm very sorry for any inconveniences it may have caused. Okay, any more questions from the floor again?
Thank you. Rocky Swift with Reuters once again. A couple days ago, the Health Ministry released some results of a survey about its HER-CIS data system for collecting information on coronavirus cases. And I believe the results showed that only about 40% of medical institutions in Japan are using this system, with some complaints saying that there are too many categories or that it duplicates some paper-based systems. So 40% seems kind of low. Can you comment on that number and any efforts perhaps to increase the cooperation or participation with that system? Thank you.
Thank you for the question about the HER-CIS. Thank you for your question. That's the patient information to be centrally organized to collect, analyze, and to disseminate the HER-CIS system. As the survey tells us, as you have mentioned, only 40% of the medical institutions input the available data. In the past, there was a different system, which is the NICIT different system. The NCIT, the former system, but the infection information, first of all, the medical doctor will diagnose, and if the patient is discovered, notification by the medical doctor is mandatory. Traditionally, facsimile, a fax, was used to transmit to the Hokenjo, the public health office, which was not systematized. And using the existing system NICIT, the public health office had to input. And therefore, traditionally, all the input was made by the public health offices. So the medical institutions or the medical doctors did not directly input the data. But after the occurrence of the novel coronavirus and patient information could not be collected quickly enough, and as a result, HERSIS was inaugurated. At the moment, 40% of the medical institutions, only 40% input. Of course, our goal is 100% of the medical institutions inputting their data. We will improve the system. Already, about the input work at the medical institutions, what are the difficulties at medical institutions, what can be done in order to alleviate the difficulty of input at the medical institutions. At the working group, we have asked experts to discuss, and a survey was conducted as part of that effort. In order to improve the situation, we want to make input as less burdensome as possible, as easy as possible. As media reporting tells us, there are so many items and information that have to be input. We have heard that complaint. Therefore, the initial input to limit the number of items at the first stage, and maybe asking for further additional items to be input in later stages. For example, we can alleviate efforts or difficulties like that. In the future, it depends on what we can do in the future, but at respective medical institutions, electronic patient record forms or electronic systems are already utilized for patient case record, but it depends on prefectures, or it depends on medical institutions whether they have electronic system or not. There is a variation, but by coordinating such available electronic patient case record forms, we are trying to make it more efficient. And in case of inputting at medical institutions, we are trying to accommodate the request to make it more easy and convenient to input, and stepwise efforts have been implemented, and such endeavors will continue. So all possible efforts are made so that providing the information will be easier.
Patrick Welter once again, Frankfurter Allgemeine Zeitung. I have two questions, if I may. First, concerning the Olympic Games next year, is there already any decision taken, concrete decision, how you're going to handle the immigration or the border entrance of athletes, potential spectators or officials? And if so, can you please explain the details? And my second question is, if you look to the infection numbers and the death numbers in Japan, although the infection numbers per day are going down, but in total, these numbers are still not really under control. If you look to the death numbers, they are going up in a very straight line. If you compare other countries in the second wave over the summer, if you look, for example, to South Korea, they were much more successful in bringing down these new infection numbers and the death rates. So what is the Japanese explanation why Japan is doing worse than South Korea or other countries in this respect?
About the Olympics and the Paralympics. Specifically about the procedures of entry and departure for the athletes. On the 23rd of this month, the government, the Olympic and the Paralympics related novel coronavirus countermeasures coordination committee was organized, and athletes related countermeasures has been discussed. About the immigration for athletes, tests for athletes. Before the end of the year, interim decisions should be made, and specific discussions are ongoing at the moment. In addition, any addition from my colleagues? No? Your second question, that it has not been fully contained. Indeed, the infection in Japan, there are some prefectures where we can say it is contained, but for some of the prefectures, indeed, the infection case is flat, or it is uncertain whether it is rising or declining. and therefore, prefecture by prefecture, we are monitoring very carefully. Please allow me to add my comment about the fatality amongst those infected. Overall, comparison with ROK, putting that aside, at least in Japan, to talk about fatality inside Japan, at the beginning of May, the so-called first wave, the peak first was at the beginning of May, and by the end of May, that was the first season, and the time until August 30, in terms of the cumulative number, comparing those two periods, the fatality has gone down. The fatality has halved. It has gone down to below 50% of the May level. There was an earlier question what the factors might be, but of course there are multiple reasons that because of the experience, treatment has improved to sustain the lives. For example, that treatment has become better because of the experience of treating patients, and the elderly population, the senior population, they have refrained from going out. The senior population are taking extra care, and the infection risk of the senior population has gone down relatively, could be another possibility. As was mentioned earlier, testing capacity has expanded. Early detection enables early treatment, avoiding severe cases, or reducing number of fatalities. We believe that such are the positive factors.
Any more questions from the floor? Oh, if none, I would like to wrap up today's briefing. Thank you very much for your kind cooperation. ありがとうございました。これで終了いたします。
With this, we'd like to conclude. Thank you very much.